What's up, guys? This is Dr. Alex Tatem, and welcome back to Hard Facts Episode 3. This is our series where we focus on ED, penile implants, and everything else related to the penis. Today, we're going to talk about one of the most important issues to men in general, and especially to men with ED who might be considering a penile implant, and that is penile length. Now, we're going to play a game.
I want to play a game.
What do you think is the average penis length? Pause the video right now and put your answer in the comments down below.
6 3/64 inches.
Now let's get this out of the way. Average erect penile length is not 6 inches. In reality, it's somewhere between 5 and 5.4 inches erect. That's 12.7 to 13.7 centimeters for you non-US dwellers out there. And this is in young, healthy men with no ED, which is an important distinction. Potency, aka the ability to achieve and maintain an erection, is essential for maintaining penis size and health. The erectile bodies inside the penis, the corpora cavernosa, are filled with incredibly oxygen-hungry tissue called corporal smooth muscle, and this tissue has to be filled with blood and stretched on a daily basis in order to stay healthy. Even if a man isn't getting sexually stimulated every day, if he's healthy, he's still going to get erections several times a night while sleeping. These nocturnal erections are not only normal and healthy, they're actually essential for maintaining penile health. When erections start to fade due to erectile dysfunction, this smooth muscle starts to contract and become replaced with scar, also known as collagen. All of a sudden, the penis can't stretch like it once could, ultimately leading to a smaller, shorter erection. This means that the moment you develop erectile dysfunction, you start to lose ground. How much ground? When studying this question, we typically look at men who are undergoing prostate removal for prostate cancer because we can pinpoint the exact date that a man has lost his sexual function. In a prospective study done at the University of Miami, 124 men were followed before, at the time of, and following their radical prostatectomy. Researchers found that men lost anywhere between 0.5 and 5 centimeters off the length of their penis. And this was independent of whether or not they had a nerve-sparing procedure. And there was no observable way to predict who was going to lose how much. So this means that you could be the guy who loses half a centimeter or the guy who loses 5 centimeters. That's almost 2 inches. And 2 inches off a penis is a big deal. This has two critical implications. Number one, if you have erectile dysfunction or have had erectile dysfunction for any significant period of time, then you have lost ground. This means that the erection you remember probably doesn't represent your penis today. Now, the best way to demonstrate this is the penile stretch test. The next time you're naked or in the shower, grab the head of your penis and pull straight out. When you've reached your limit, that is the best estimate of your erect penis. This is something that I do on every patient in our practice going into penile implant placement so they can understand what we have to work with. And when I have doctors visit me to train, I teach them to do the exact same thing for their patients. Now, this loss can be slowed down a bit with exercises like the VED. We'll talk more about that on later episodes. But this is a very real and progressive problem that only gets worse with time. Now, the second implication has to do with penile implant placement itself. And if you only remember one thing from this episode, remember this. The penile implant is the only thing that stops penile length loss in its tracks, period. When a penile implant is placed, we maximally fill the penis with saline so we can stretch those corporal bodies as much as possible. Then we measure the penis and place the device with gentle upsizing, just slightly larger than what we measured. This gives guys a chance to grow with time and regular exercise of their device. Now, as the body heals around the implant, it forms something called a surgical capsule. This is a special type of tissue that prevents any further length and girth loss. So men can stop size loss, restore their sexual function, and even gain some ground back with their penile implant. So if you're a man with ED and you care about the size of your penis, then the best thing you can do is get your implant sooner rather than later. Seek out a high-volume, dedicated implanter and understand that while none of us can give you the penis you had 15 or even 5 years ago, we can give you the best possible penis you can have moving forward. So that's it for Hard Facts Episode 3. If you like what we do here and want to see more, click that like button, subscribe, ring the notification bell, and leave your question in the comments down below. Every little bit helps the YouTube algorithm and helps justify to my wife why I'm going to be getting home late tonight. Until next time, this is Dr. Alex Tatem, signing off.